Backyard chicken coops have popped up in yards across Greater Victoria over the past decade. That's when most municipalities in the region allowed for small flocks. It's largely thanks to the advocacy of urbanites hungry for a zero-mile diet of fresh eggs. But backyard chickens are much more than just food producers. They also have names and personalities and are beloved pets to many. And as it is for any family pet, there are tough decisions to be made when they fall ill. CBC's Roseanne Holman took a visit to the VCA Canada Central Saanich Animal Hospital to find out more about what it takes to own a backyard flock. She spoke with veterinarian Dr. Breanna Clooney, as well as Rob Griffin, who came in with his chicken named Tara.
So you could book an appointment if you were free or if you wanted to.
Great. I'll just shut the door so there's less noise. And you can plop her down wherever you want.
Okay. There you go, Tara. That's Tara.
Hi, Tara. So how many chickens do you have?
I have 5.
Okay. And how long have you had all of them for?
They're 3 years coming up in May.
Okay, perfect. And everyone, I understand, is pretty healthy right now?
Yes, they're laying well and eat well, and they seem to be pretty happy.
Perfect, nice. And then what are you feeding them right now?
16% layer pellets.
Okay.
They love the dried mealworm type bugs. They're a bit of a treat to coax them in once in a while. They love corn on the cob, watermelon. My goal is to give them the best life they could possibly have. Look at that. There you go.
I understand not many vets are willing to see chickens. Why do you want that to be part of your practice?
I like seeing all animals just because it's something interesting and different to kind of spice up your day a little bit. I also want to help all the animals that I can. I'm comfortable around birds. I'm more than willing to put in the time to do a little bit of extra research to figure out what needs to be done for them. So it's just something that, because I'm comfortable and I like the excitement, I'm more than willing to see them.
So what are the range of ailments that might bring a chicken in to see you?
A lot of the time it is more emergent conditions, more than a wellness exam. So some examples are egg binding, where a chicken is unable to lay an egg. It basically gets stuck in the canal, and that can be a quite life-threatening emergency quite quickly. So we basically have to relieve that obstruction and help them pass that egg. Other examples are diarrhea a lot of the time, where they either have a high parasite burden or something wrong with their feed. And then the occasional sniffles as well is quite common. So always kind of just introduce yourself to the chicken. Some chickens are used to handling, other chickens it's a lot more stressful, so it does vary client to client and chicken to chicken. So once I've kind of assessed how happy they are with handling, I tend to listen to their lungs and chest a little bit. And then I do slide back to listen to their belly just to see if there's any excessive GI tract noises. And then I do go down and I feel their crop. Oftentimes it can be them coming in for crop distension issues, so they're not fully moving feed through their intestinal tract. And so sometimes they get impacted and we have to treat that. So just assessing, because it felt a little on the fuller side, that's why I asked, had she eaten this morning? Because if she hadn't, that might be a point of concern. And then I always kind of have a bit of a feel of their abdomen to feel for any lumps or bumps. And then most of them hate this part, but I do have a quick look down in their mouth.
Are chickens more challenging to diagnose and treat than other animals?
I would say they are. Chickens are considered a prey species, which means they do their best to try and hide any sign of sickness so they don't look like the weak one in the flock to a predator. So a lot of the time on physical exam, they're trying to seem as bright and happy as possible. They don't tend to vocalize when they're in pain. So it's a lot more detective work. And oftentimes we have to reach for those additional diagnostics to help us figure out what exactly is going on.
What kind of an expense would a chicken owner face when they bring their chicken to the vet?
The initial exam is around that $100 mark, and then dependent on if I need extra diagnostics past that, I'd say you could walk out of here with a $200 bill all the way up to maybe a $500 bill.
Why are people willing to shell out hundreds of dollars for their chicken?
I think people do truly see them as pets and do have an emotional connection with them. When you do meet individual chickens, they do actually have quite a bit of personality. So I do have quite a few clients who treat them just as they would a dog or a cat and have that same level of emotional attachment.
And what kind of chicken is this one?
This, there's numerous names. It's a hybrid brown. I'm not sure the exact name of it. It's not a fancy breed. It's just a hybrid egg layer.
Yeah. And what's her personality?
This one, she's the friendliest. She's the first one to come and hop onto your lap if you're sitting somewhere where she is, and loves attention. Not a follower as much as the others. She does her own thing and wants more human attention than the others. Chickens are an underrated pet.
Yeah?
I think.
What do you mean?
They have personalities. You have to know what you're doing a little bit, but there's so much information available. So many people in my neighborhood have chickens. That's how I got started. And it just seems